Hello, everyone. Welcome back to the Vebis Q&A webinar, where we get to sit down and chat with some inspiring people in our community, and most importantly, learn. Today, I'm with Arlie, who is a speech-language pathologist, and I just want to start by asking how you're doing today, Arlie.
I'm doing really well, thanks, Tyrell. How are you?
I'm good. Yeah, I'm really excited to chat. I'm not experienced at all in speech therapy. I don't know anything, so yeah, I'm really excited to learn.
Me too. This is my first webinar, so I'm excited to learn
Okay,
how this goes too.
awesome. So just to start, can you just tell us a bit about yourself and what inspired you to become a speech therapist?
Yeah, absolutely. So I grew up on Vancouver Island, born and bred, and I went to school at firstly Simon Fraser, then UVic, and then I did my master's degree at the University of Alberta. And I think I'm a bit of an anomaly in the field of speech therapy about how I got onto this track. Firstly, I had speech therapy when I was a child, pretty intensive speech therapy from like kind of the pre-kindergarten years. Only my brother could understand me. And when he stopped being able to understand and translate, my parents realized it was probably time to get some help. But that's not actually what inspired me to become a speech therapist. In my first year of university at Simon Fraser, I took a linguistics class, just like an intro to linguistics class on a whim because it meant I got Fridays off. And it happened to be the first class of my first day of my first year. And the professor started off this lesson by talking about how the word nest is an Old English compound word that means a sit down. And my mind was blown. I have this flashbulb memory of thinking, oh my goodness. And after the lecture, I went down and spoke to him and I said, how can I study this for the rest of my degree and what do I do? And he said, most people who study linguistics become speech therapists. And I said, great, what do I need? Where do I go to school? He told me where to go. I went home that day. I printed out the prerequisites to get into the master's program, and I called the school counselor the next day and changed all my courses. And I tailored my entire undergrad degree to be
Wow,
a University of Alberta speech language pathologist.
that is so interesting. Wow, that's so
Yeah.
funny.
So just a passion for language, really. A passion for
Yeah.
language, a passion for communication. I'm just a big old linguistics nerd.
Yeah, cool. Wow. It's really interesting that you have that personal experience, like struggling with communication. Would you
Yes.
say that helps you a lot in your like daily like life, just working with clients and stuff, like understanding where they're coming from?
Yeah, I think that coupled with my undergrad is in psychology and kind of with a more focus on developmental psychology and child psychology, understanding how when kids aren't able to interact with others, and that generalizes to adults as well, and express themselves fully, how that can lead to feeling isolated and sort of the social dimensions that come into that, and having the personal experience with it as a young child. I think that really helped underscore that need to help people be able to integrate fully with their community.
Cool. Wow.
Yeah.
I actually had an issue when I was a kid with my S's, those pesky S's. I would slur them. They would come from like the back here in
Yeah,
the
the
cheek.
lateral list.
Yeah. And so I have a bit of experience like with I was really young, but I do remember it being like a really fun environment, which I thought was cool because you don't usually think like a kid would be excited to go to speech therapy, but I was excited. Yeah.
Yeah,
Um,
that's I am in a playroom for most of my days, and that's the same with adults, right? The way we learn best, whether you're a child or an adult, is when you're having fun. And
mm,
so that's a big part of my job that I feel super privileged to have, regardless of the population I'm working with, is so much of my day is spent creating and having fun with people.
cool. Wow. That's awesome. And so I'm curious, like, how does it look different when you're dealing with someone who has had a brain injury? Or is it any different? Yeah,
Compared to
compared
like with
to like just someone that just naturally developed a speech,
Yes,
impediment?
absolutely. That's a good question. So there's sort of two ways that we look at communication difficulties. One would be developmental, one is acquired. And so one you're born with and you just develop, probably like your lisp growing up, and the other is acquired. And that can happen at any stage of life. So I have worked with kids who are in their early elementary years who have an acquired speech disorder because of a brain injury. And so what changes there is sometimes what the prognosis looks like and sometimes what your treatment strategies are. But at the end of the day, we are fundamentally supporting communication. And while the treatment methods might be a little bit different, if you're retraining the brain to think about speech sounds in a different pattern for a kid with a developmental phonological disorder versus retraining those muscles to move your tongue to make clear, precise articulation with somebody who's had a brain injury. The strategies might be slightly different, but the overall goal is always still the same.
Okay. Interesting. Are you willing to like talk a little bit what like an example of what a strategy would be like? Like you were talking about like issues with like your tongue, like what is
Yeah.
it, like an exercise or?
I think the first thing here that's really important to break down and tease apart for people is sort of the vocab that we use to talk about this. So unless you're a speech therapist, you probably haven't thought in very much detail about the difference between speech, language, and communication. Lucky for you, it's something we think very in depth about. So when we're talking about communication, we're talking about any way people interact. When we're talking about speech and articulation, we're talking about how you physically create those sounds. So how your tongue is moving, how your lips are moving, how your breath is supporting those sounds. When we talk about language, we're talking about the ideas that happen in your brain. And so speech is sort of the representation of language that comes out. So with that vocabulary in mind, when we're talking about articulation, we're really talking about how we're moving our articulators, like our lips and our teeth, our lips and our tongue rather, to create those sounds. And so sometimes working with someone who's had a brain injury, you might notice that speech is pretty unclear and the sounds, well, you can understand them, they just aren't quite as crisp as they used to be. So we're working on making sure that the tongue is going to the right spot in the mouth to make that sound. And same with a child who has maybe learned how to make that sound incorrectly from birth. We're just training that spot, and we do it through repetition. So we start just at the base level, getting the sound all on its own. So for you, for the S, practicing where that tongue tip needs to be to get the airflow right down the middle and have it nice and crisp and clear, a little smile, nice and relaxed, air right down the middle, tongue by your teeth. And that's going to look the same. The techniques to make those sound are the same regardless of what's causing the difficulty. So we start with the sound on its own, and then we build it up into words, and then we put it into sentences and stories, and we use it in conversation, and we practice to build that consistent repetition of where your tongue is going to go when it makes the sound.
Cool. Wow. Interesting. So, and is it like, I guess it's like a practice makes perfect kind of thing. Like it takes a bit of time. How do
It's
you
like
deal?
physio for your tongue.
Yeah, right, right. I'm just thinking, how do you deal with like just struggles with like patience? Like I know communication is so important, right? Not being able to communicate is something that we see here with brain injuries, and that comes along with a lot of like frustration. And I can imagine having to like practice over time, like just speech functions and stuff would be frustrating.
Yeah.
How do you deal with that general like frustration that people will feel during that process?
Yeah, I'm glad you bring that up. It's such a natural part of working through a brain injury is that frustration. And I think a lot of it's the grief that comes along with that change, and you're grieving a part of who you were, how you used to interact with the world. And so one of the first questions I ask people when I meet them, when we're doing the intake and getting to know each other, is if they have somebody that they're speaking to, whether that's a counselor or a psychologist, or a spiritual leader, if that's something they have to help them get through this time and help process those emotions. Because while I'm here to be a sympathetic listener and I can validate those emotions and hear them, I really love it when people have that kind of complete circle of support to help process that. It really comes into family, professional, as well as the person to work through those emotions. But the number one thing I always encourage people to do is like take your break when you need it. If you're getting frustrated, it's not going to help your speech or your communication. When those emotions get high and we have big feelings, it makes it harder for us to communicate. And that's the same if you've had a brain injury or if you haven't. It's just exacerbated if you have. And so we can take a break, we can regulate ourselves, and we can come back at it. And trying as much as possible without it being done in sort of that obnoxious, toxic positivity way, to stay positive and to find little markers of success, to look back and say, like, a month ago, this was hard and I can do it a lot more easily now. And so that's one of the big things when we're getting into that frustration is I really try to encourage a reflection of what's one small difference that you've noticed and what does that say about the future.
Cool. I think that applies to everything.
Everything.
That's great advice. Yeah, totally. I think, being an athlete, like, yeah, sometimes it just can be so frustrating when you're practicing at something and you don't see results. And so I can't imagine, I don't need to play basketball to, function but I need to be able to communicate. And so I can't imagine how much that frustration would just be like heightened.
Yeah. I think tied into that too, Tyrell, is that it's so important to set those realistic goals for ourselves. Like if you're playing basketball or if you're working on supporting your communication and continuing to grow that, making sure, and this is where professionals really come in, I think, that the goals that you're setting for yourself are realistic and they are achievable within a reasonable time frame. So often when patients come in, I say, what's your goal? Like, what's the end goal here? It's usually, I want to be back to my pre-injury self. And while I think that is such an amazing goal for us to strive for in the future, to set those short-term goals, because I can tell you that's probably not going to happen in a month. And to set small goals of, like, I want to order coffee independently in a coffee shop. Beautiful. Let's work towards that. And we can see the improvement a little more closely. But when the goals are set so far in the future and they're such big goals, just like, hey, I want to be an NBA star one day, it's hard to see yourself progressing towards that. So making sure that we're setting realistic goals that's really, I think, such an important responsibility of a professional, whether it's a speech therapist or a physical therapist, an occupational therapist, to say, I love this goal. What's a small step we can take towards that, and work there. Can help kind of mitigate some of that frustration because you have those successes and you can see those successes.
You have those moments where you can celebrate that you've achieved something. I love that.
Absolutely.
That's so cool. You've touched on this a little bit. I'm wondering, like, for someone who may be watching and listening right now, and they were interested in booking an appointment with you, I'm just wondering if you could talk about what they can expect, what that process would look like.
Yeah. So I think the first important thing to do here when you're looking for a speech therapist, there's great websites out there. There's one called VISLP, and it's a list of all of the private speech therapists in Victoria. Not every speech therapist specializes in working with brain injuries. A lot of people specialize in working with different populations, whether that is children or brain injury or more like school-aged kids reading and writing. So take a look through a website like VISLP and find somebody whose specialties really resonate with what you are wanting to work on. And then, for example, if that was somebody like me, what a session usually looks like, the first session is getting to know each other, and we do a bit of an assessment. So I gather a pretty comprehensive history of your medical history, and if there's anything about where you are in your life right now that I need to know to make sure we can make sure treatment is as successful as possible. Get some, if you've got a spouse with you or family, caregiver, I love to ask them some questions as well to get a really holistic picture of where you're at. And then we do an assessment. It will look different for most people because, as you know, no one brain injury is the same.
Totally.
And so based on what people are experiencing and what they're wanting to look on, the assessment process can look pretty different. But we do want to look at all domains of communication. So we are looking at how they are able to find the right words to express what they're looking for, what that process looks like. Some people it's not affected at all. Some people that's the real issue.
Right.
Sometimes we're looking at how clear their speech is. And once again, that can be impacted for some people quite severely and not at all for others. Has their voice changed? SLPs can help with voice disorders, and that can be based off of the nerves that help your vocal folds move and your breath support if that has changed post-injury. Sometimes it can be tricky to pick the appropriate words and to know how much to share and when to stop sharing. That's that sort of social communication piece. Maybe memory is impacted or focus is impacted, and that's affecting how you're interacting. We call that cognitive communication. So we've got different assessment tools for all of those domains, and it's really tailored to what that specific person needs.
Okay, so like no two process is the same, kind of like after the assessment, it's completely different
It's
what you're
tailored to
kind
the
of focusing
person.
on. Yeah,
Yeah, there's no
cool.
one size fits all.
Yeah.
A comprehensive assessment to make sure we're really zoomed in on the specific needs of each person, and then together we can develop a collaborative plan and set goals that are meaningful to the person and meaningful to the family that will help them reach that long-term goal of communicating with confidence and effectively.
Cool. So, do you collaborate at all with like other healthcare professionals? Like if somebody came to you and you're like, "Oh, I don't think I'm the perfect fit for you," do you have like references and like connections for those clients?
Yeah, so if it's with another speech therapist, absolutely. I refer people fairly often because once again, another responsibility of the professional is to know your limitations. So
Mm.
voice, not my strong suit. There are really amazing speech therapists in Victoria who specialize in voice. It's their bread and butter. And maybe I can help them with part of their journey and then refer them for further support for voice. Same with swallowing disorders. That used to be my bread and butter.
Mm.
Excuse the pun. But I worked in a hospital at that time, and I don't have access to the same resources here in a private setting. And so I will refer for that as well. And I think just like with a physio who specializes in hand therapy versus with chronic pain, it's so important for us to know who's out there in our communities and be able to refer our clients onto the most appropriate person.
Cool. Cool. Interesting. Wow. Yeah, it's good to know. I think like yeah, it's important for everyone to be connected. We've done a bit of focus here on trying to be more connected to other nonprofits because we have
Mm-hmm.
people come in and it's like we can help you, but you like we can't provide exactly what you need here, and
Yeah,
so and that comes like the other way, and so like those connections are really important. Yeah,
yeah,
it's all about getting the
absolutely.
best care possible.
And sometimes that's not a speech therapist. Like sometimes people come to me and their main concerns are related to memory and attention. And while that
Mm,
does touch in some ways into the speech pathology realm when it comes to cognitive communication, there are limitations, especially for me and my area of practice of how I can support someone. And so I often refer to occupational therapists, for example, who are really great resources in the fields of memory and attention and activities of daily living. So we can it can be interprofessional referrals that way too, where there's some crossover between the professional scopes of practice, and it might be better suited to have a different profession intervene as well.
yeah, cool. Um, what kind of long-term care strategies do you suggest? Like after, let's say, most of the goals that they set for themselves have been reached, Do you have
Yeah.
suggestions for those clients? Like, do they need to keep at it, their practice, or are they kind of good to go? Um, yeah, what does that look like?
I think making sure that you establish a regular practice routine is really important for maintenance. And I know I've made a bunch of kind of analogies here to physical
Mm,
health, but in the same way that once you've recovered from an injury, you continue to strengthen those muscles
mm,
so that you don't re injure yourself and so that you don't lose the progress that you have made. Is important. And maybe that progress or that practice routine is less intensive than it was as you were initially reaching those goals, but consistency really is key here. So I always encourage ongoing practice of communication strategies. Um, this can really be just wrapped up into your daily routine. I also encourage people to stay engaged in their social activities as much as possible. Sometimes in that initial therapy, you're so surrounded by a community of people. And
mm.
as you progress and you feel more confident and more independent, you sometimes lose a little bit of that social support and you don't have as many opportunities to practice your communication skills. So, as much as possible, staying engaged in social activities to both energize yourself but also practicing those language skills. If you notice anything is changing and you're like, oh, I can't do this as well as I used to, or I don't feel as confident with this, don't hesitate to check back in with your therapist.
Right.
I also find there's online, like through Facebook or through other nonprofit organizations, there's a lot of support groups. And so even if you have met your goals and you feel like you've really made a ton of progress and you maybe stopped therapy, that doesn't mean that you can't still benefit from support and you can't connect with other people. And maybe you're supporting them by sharing your story and your advice. So joining support groups when it's possible, as well as continuing to make healthy living choices. We know that physical health and cognitive function are really intertwined. So keeping up that physical activity, getting out there for walks, doing exercise that you enjoy can be really important. And then finally, I like to encourage my patients to work on mindfulness and stress management strategies. And that kind of ties into that feeling of frustration we were talking about before.
Right.
And so keeping up with, if you've got a routine for mindfulness practice, that's great to continue on as well. So the post-therapy phase is really about integrating all the strategies back into your life and kind of a journey of lifelong learning.
Cool. Cool. I think like with brain injury, sometimes we see it's like 2 steps forward, 1 step back, and that's kind of how it
Mhm.
goes. Is that kind of the same with like recovery for speech? Is it normal for people to have good days and bad days in that sense?
Yeah, absolutely. It's kind of that rehab continuum, and we see it across all domains of recovery, right? Sometimes you have that sharp peak in the beginning, and you really make a ton of progress, and then you have a dip, and you plateau, and you go back. And I think giving yourself the space to experience that, but also education from professionals that is normal, and there's nothing wrong going on, that we can expect those peaks and valleys, and it tends to trend upwards, but there's going to be tough days and there's going to be great days, and there's going to be days that don't change at all.
I love that. That's awesome. Um, just think of motivation for people who may be um, listening. Do you have any inspiring stories or inspiring words for anyone that may be struggling with speech?
Yeah, I think the story, and it always gives me goosebumps when I tell it. It was about 3 years ago now. I was working in Alberta, and I was working with a young mom who was had experienced a traumatic brain injury, and her life was really completely changed. She wasn't working anymore, and her speech and communication were so severely impacted. And the number one goal that we were working on was saying her children's name. She had 2 young
Mm,
kids, and because of the type of difficulty she was experiencing, the motor planning difficulty, it's called apraxia of speech, she wasn't able to say her children's names, and that was our primary goal. And after several weeks of therapy, I will never forget the name never forget the moment rather, that we pulled out the pictures and we were working on it, and she pointed to her son and said his name, and she cried and
Wow.
I cried and her kid cried, and it was just this beautiful moment that I think it's so easy for us to take communication for granted,
Mm-hmm.
and to have moments like that that underscore the humanity that is encapsulated in our ability to communicate how we want, that like that will never leave me, that moment where she was able to say her son's name, even though she could communicate with him before by pointing to him and she knew
Mm-hmm.
what his name sounded like, but to have those words come out of her mouth was just a priceless moment.
Wow. Wow, that is so cool. That's yeah. Yeah, it is crazy to think like we really just don't acknowledge how blessed we are to be able to just communicate. Like it's such a
Yeah.
necessity in life. And yeah, that is wow. That's a really good story.
I feel very privileged to have in my career, which is still a pretty young career at this point, to
Mhm.
have been there for that moment and several first I love yous to partners and other family members. Like it really is a privilege to be there to witness those moments. And then I think another motivational piece that I like to share with clients as well is this sort of analogy when we're talking about changes in communication, where oftentimes people feel like the way others have viewed them has changed, and language difficulties are not cognitive difficulties, in that like their intelligence hasn't necessarily changed because of this difficulty expressing their
Mhm.
thoughts and ideas,
It's just getting
and
it out.
is just getting out those ideas that being that person is still in here, it's still
Yeah.
intact. It's just getting that out. And the analogy we use sometimes in speech therapy is it's as if you've taken a flight to another country, where before you got on the plane, you could express your thoughts and feelings and ideas with those around you with ease. And you have flown to the other side of the world, and everyone is communicating in a different language. And you aren't able to share those thoughts and ideas with the people around you. Now, the value of those thoughts and ideas and the content of those thoughts and ideas hasn't changed. You're just
Yeah.
in an environment where you aren't able to express those and share those easily with the people around you. But there's nothing on that flight that has changed the value, the inherent value and worth of those ideas. And so I think kind of phrasing it like that helps us understand as well that the context around us impacts it. It's not just us, it's the people around us need to help support, get those ideas out. They can find different ways to support the individual in sharing their thoughts and feelings. It's not just the onus on one person. And so that's another one I like to share with people as well, is sort of that analogy of taking a flight and no longer being able to express yourself.
I love that. I love that. And I like that you're talking like it's not just the person who's struggling to communicate. It's not just
Yeah,
their responsibility to help. It's also the people around. And that's really cool. That definitely puts it into perspective for someone who's never really struggled with communication to be able to,
yeah,
yeah, yeah. I've gone to Mexico before and felt like like everyone spoke Spanish, and you know, you have so much you want to say, but you just can't
you can't.
get
Yeah.
it out. And yeah. Hmm.
I think on that note, Tyrell, too, like the idea of other people needing to support on it, a phrase that we use a lot in speech therapy is communication partner.
Mm.
And that refers to anyone you're having a conversation with. You are their communication partner. Right now, you are mine and I am yours. And the word partner in it really highlights the dual responsibility we have, right? My responsibility here is to make sure that you're feeling understood and heard, and to make that as
Mm.
easy as possible for you, just as you are doing the same for me. And when you're interacting with somebody who has an acquired brain injury or acquired communication difficulties, that is our responsibility as well. We are not just a passive participant. We are an active partner in that. And there are things we can change about our communication and the way that we communicate, as well as the way we absorb and help information come out, that facilitate that. And so it highlights a role of responsibility, I think.
I love that. Oh, that's so cool. Yeah. Yeah, I think definitely when like speaking with people that have had a brain injury, when I started here, it was a big learning experience.
Yeah.
And I learned like it's not just on them to communicate to me, it's up to me to maybe ask the right questions or
Mhm.
allow them. Like a big thing, we're so used to always filling in the quiet space when we talk, and
Mhm.
so someone will talk to me and they'll stop halfway through the sentence, and my natural instinct is to finish the sentence for them,
Yeah.
but that's not really helping them. They don't want me to do that, and so being able to understand that communication might need to be slower, and then just taking that time to listen. And yeah, I love the idea of it's a partnership, like you're partnering with them. Yeah, I love that.
Yeah, yeah. No, that's such a really good reflection, Tyrell, that we have that tendency to fill in the space. I love how you
Hmm.
phrased that. And creating space to allow them to feel autonomy and communicate at their own speed and finding ways that they agree upon for support. Like some people are like, yes, please guess the word. If you know the word that I'm trying to say, please guess it for me. And other people are like, So having
Yeah,
that sort of conversation can be so helpful too when you're first forming a relationship with someone is what strategies can I use to support you? Does it help you if I do this or does that tick you off?
right.
And making sure that we're honoring that too, because that can look different for different people. And making sure that the strategies that we're using as listeners is actually something that they want.
Yeah, cool. Yeah. um that is almost all of the, if not all of the questions I had for you. We did go way off of what I had prepared, but I love that. It's been such a great conversation, and I've learned so much. Is there anything else that you would like to say, to maybe anybody that's listening, that may have a brain injury and struggles with speech, or has a family or friend that struggles with speech?
Yeah, don't hesitate to reach out. And even if it's just sending a first contact email and saying, this is the situation I'm in, is this something a speech therapist could help with? Can be so empowering. And the number of people I have had say to me over the last 3-4 years, I didn't know a speech therapist could do this.
Hmm.
I can't even count. So just reaching out and seeing if there is a possibility for help, if that's something a speech therapist can help you with, 100% go for it. Do it. Send an email, make a phone call. Most SLPs will have or a lot of SLPs, I shouldn't say most, have like a free consultation or will happily take a phone call to discuss whether it's an appropriate referral. So yeah, don't be scared to reach out, and there can be hope out there, and SLPs can do more than people expect. So
I love it.
yeah, give us a call.
That's awesome. Yes, don't be afraid to take the first step. That's the most important step. I love that.
Absolutely.
That's awesome. Well, thank you so much for your time. Um, and thank you, everyone that stayed and listened. I hope this was really helpful for somebody out there. Yeah, so thank you, Arlie.
You too. My pleasure. Thank you so much for inviting me to be here, Tyrell. This was great.
Thank you.